Hi, I'm Sinchita Maurya, Executive Medical Director at Biomia Fusion. On behalf of all authors, I'm pleased to provide a short summary of our poster describing case studies from Covalent-111 trial, a phase 1-2 trial of BMF-219, a covalent menin inhibitor in patients with type 2 diabetes. By way of background, the root cause of type 2 diabetes is gradual decline in beta cell number and function. Type 2 diabetes patients have only 50% of beta cell pool remaining in their pancreas at the time of diagnosis, with 5 to 10% annual decline post-diagnosis. Menin, a scaffold protein, is an important regulator of glucose control. In normal physiological conditions such as pregnancy, inhibition of menin results in enhanced beta cell mass and function. BMF-219, an oral covalent menin inhibitor, is under clinical development for the treatment of type 2 and type 1 diabetes. We have previously reported improved glycemic control with only 4 weeks of BMF-219 treatment as 100 and 200 mg once daily dosing and persistence of glycemic control in over 1/3 of patients for up to 22 weeks after stopping therapy. Here we present week 26 follow-up data in 2 patients subsequent to 4 weeks of either 100 mg or 200 mg BMF-219 treatment in patients with type 2 diabetes poorly controlled with up to 3 antidiabetic agents. As before, both patients were treated for 4 weeks and then followed for additional 22 weeks after completion of treatment. In the 32 patients treated at these doses, at week 26, at least 0.5% reduction in HbA1c was seen in 39% of patients. These patients achieving a mean reduction in HbA1c of 1.3% at week 26. The brief case illustrated in the poster describes a 29-year-old man with a 4-year history of type 2 diabetes. He was poorly controlled with HbA1c of 9.5% despite being on dual agent therapy, metformin and SGLT2 inhibitor. He was treated with BMF-219 200 mg once daily dosing for 4 weeks. His HbA1c progressively improved over 26 weeks, a 2.5% reduction at week 26. And the time in range measured by continuous glucose monitoring increased to almost 90% during the follow-up, a 56% increase from the baseline. There was an increase in HOMA-B by 190% and C-peptide increase of 71% at week 26, which well correlates with glycemic control. Again, this was 4 weeks of treatment and over 5 months of treatment period. Another illustrative patient case in the poster describes a 49-year-old man with a 10-year history of type 2 diabetes. The patient was poorly controlled with HbA1c of 8.6% despite receiving metformin. He was treated with BMF-219 100 mg once daily for 4 weeks. His HbA1c improved over the 26-week study period. At week 26 time point, 1.1% reduction in HbA1c was noted. In addition, time in range measured by continuous glucose monitoring increased to almost 80%, a 75% increase from the baseline. There was an increase in HOMA-B by 12.33% and C-peptide increase of 59% at week 26, which well correlates with glycemic response. In summary, these case studies illustrate potential disease-modifying and durable effect of short-term BMF-219 treatment in patients with uncontrolled type 2 diabetes. Patient experienced a continuous improvement in HbA1c and improvement in time in range on CGM during the follow-up period. Increase in HOMA-B and C-peptide well correlates with glycemic control, supporting BMF-219 core mechanism of action of beta cell proliferation, improving beta cell function in patients with type 2 diabetes. In the ongoing next phase of the study, that is the expansion phase, patients with poorly controlled type 2 diabetes are being treated for up to 12 weeks of daily BMF-219 treatment and followed for up to week 52 or 1 year. Data from this stage of the study will be presented at upcoming scientific conference. Thank you for your time.